One of the techniques we're going to talk about for this pec major, pec minor area is rolling. I really like that fifth metacarpal head. Traditional rolling is certainly an option. You can also just use that as your pressing or penetrating tool. Being careful of the acromion is kind of the most important thing for a comfort standpoint. And obviously, you know, working on muscle tissue, not breast tissue, is kind of an important thing. So on a lot of people, I can get in and work this direction towards the clavicle and the acromion. If it's more comfortable, you can get in and work the opposite direction. Just kind of roll off the coracoid, rather, not the acromion. Just into the pec. Sometimes it's easier if you bring the arm up into external rotation, little abduction, like that, whether you're working down or whether you're working up. Just kind of play with it with the person you're working on. If you're working and just using a static pressure with that knuckle, then you can get in and work pec minor a little bit. Usually if I'm doing that, I'm going to try to get some elevation of the shoulder girdle to put a little stretch into pec minor while I work. Just let me know if that's too much. Say what?
I was telling him to say edge because he might not be as flexible with her, and I'm trying to be.
Sure. Pec minor is one of those areas that's often overlooked, and it's such an important muscle for the whole shoulder girdle. So it's a good one to get in and work. I tend to like to do it with that knuckle, partly because digging up under here, under pec major with your fingers just hurts, and it's awkward and uncomfortable for a lot of people, and it doesn't necessarily get any better access really to pec minor for me. Also, being a man working predominantly on women, getting in this area here, that puts the back of my hand and my knuckles kind of in contact with the pec and feels less like trying to grab a hold of stuff that I'm not supposed to grab a hold of. So, you know, just seems to be easier for me to get in and work with that, and I can get the same kind of results most of the time. So that's rolling on the pec itself. We're going to talk about working on subscap. We're going to do a lot of work to this shoulder tomorrow with mobilizations, but just for the sort of straight body work, subscap is an area that I spend a lot of time working. Generally, I like to actually test range of motion. I usually do it when people are prone, but I try to see how far does the shoulder actually rotate before the scapula starts trying to move. And you can see and feel when that scapula starts to shift. And in supposedly a healthy shoulder, it should already be here before the scapula starts to move. And in most people, you get movement in that scapula a little before then. Likewise, going the other way, you're not supposed to quite get to the level of the table before it moves. Hers is pretty much there. She's got good internal and good external rotation, really. But if I'm going to try to get into work the subscap, I need to be able to do a few different things. Yeah, you may need to be over here, darling, with the camera. The first thing I need to be able to do is feel for the rib cage. So I'm bringing the arm out of my way and I'm pushing straight in until I feel her ribs with my fingertips. Then I'm going to push down and try to feel for the edge of the scapula. And that's right here. Then I get the fun job of splitting the difference and going between those two and slowly but firmly reaching in between. If you're not sure if you're there yet, pick the arm up and it'll squeeze your fingertips between the scapula and the rib cage and let you know that yes, you are indeed in where subscap lives. The arm doesn't have to stay up. We're going to do a bunch of moving it around while we work in here tomorrow. For right now, just try to get comfortable actually getting the fingertips into that area. It's a very tender spot, so definitely breathe. And if it's too much, the safe word is banana. You know, don't let me hurt you. Don't let your partner hurt you. Subscap is one that if you do that range of motion testing before and they have limited external range of motion, and you spend 5 minutes in here working subscap and retest it, you'll see improvement. It's amazing how much range of motion change you can get in a relatively short time. That's getting in with the subscap. Make sure when you're doing that your palm is facing downward. We don't want to be pressing in with the palm this direction, especially if we're trying to lift. We don't want the palm headed towards breast tissue, or the back of the hand towards breast tissue. And if you're working on somebody who's rather well endowed, have them reach over and hold over the drapes, hold the breast tissue out of the way. And that way, if you bump anything, it's the back of their hand, which is a lot more comfortable. So, simple enough. All right, we're not done yet. I just wanted to check my list. So, that's our subscap. The ringing techniques that we did from prone position, we can also come in here and do. So I can ring the bicep, just like I rang out the tricep, cross-fibering, counter-rotating, and dragging down. The bicep can be even more tender than the tricep, so just let me know if I dig too hard. Just like that. You can ring out the forearm in this kind of position as well. Just counter-rotating and twisting. And our variation of ringing, where we were twisting the forearm while ringing with one hand, works in the extensor compartment, just like the flexor compartment. That one's unhappy with you. That's that extensor digitorum. You can see that middle finger move when I strum across it there.
Oh, that's so weird.
That's muscle fasciculation. That means there's a trigger point there. Or a motor point, one. So, ringing in the forearm works just fine. The penetrating with the elbow that I have up here is just like we were doing in the flexor compartment. As long as they have enough internal rotation to lay the arm flat, then we can come in and work those same muscles here with our elbow, just like we were working on the flexor side. Honestly, I do a fair bit of forearm work supine even for the flexors, because if they have the shoulder range of motion to put the arm up here, I can get in and work flexors and extensors, you know, both from this position. But if they don't have that kind of range of motion, don't force it, obviously. So elbow pressing, which we've done a bunch, or penetrating, can be done here. The circling that we were doing before applies here. Obviously, you can still do it on the palm, but we can also get in and work on the posterior or the dorsum of the wrist with that. Easy enough. The lunate bone, which is right in the center of the wrist, accessible on the posterior side, is the most commonly dislocated of the wrist bones, the carpals. So a lot of times there's pain from mobility or a lack of mobility with it. So I'll do a version of this where I'm just pushing up and down on the lunate with my fingers underneath and my thumb on top while making a little circle. Just gently moves the lunate bone up and down while we move. And that can be a really good one if there's any excess irritation in those joints or laxity in the ligaments. You'll kind of know about it. So that's another variant of our circling. The other one we have up here, if I actually look at the right side of my board there, is our pips or our chup technique. And this can be done on the palm side of the hand here in a supine position pretty easily. I just match the pressure with a palm on the back. So I'm using a chup on the front, just like so, and I'm pressing on the back. And it doesn't even have to be horizontal. Their hand can be down. And as I drag the pips down the palm, the flat of my palm matches that underneath. And it's a short stroke, just the length of the palm itself. Just like that. It's a terrible chocolate chip cookie, I tell you. Nice thing about that is I'm not having to use my thumb. My thumb is relaxed and resting. So that's our chop on the palm. And then the last one that I've got listed up there is a stupidly simple one that we haven't actually talked at all about, and that's pinching, which we use what we call a monkey pinch a lot in Chinese martial arts and Chinese medicine. And it's just squeezing the thumb against the side of the pip joint for the index finger. And it's a great way to stimulate small points. We use this for stimulating points on things like fingers and the ear, but also this web between the thumb and the index finger. There's a lot of nerve endings here. There's a very commonly used acupuncture point called Li4, large intestine 4, or Hegu in Chinese. And it's wonderful for any issue with the head or the face or the neck. So headaches, TMJ pain, eye pain, jaw pain, any sort of neck trouble, it's a good spot to go and work. And we work that often by squeezing the whole web. So we get up near where the bones meet, press in. I like to kind of drag down, squeeze the whole area. Too much? Huh? Okay. Just a strange feeling? No worries. Cooks actually use this same area and press in on it to know how to cook a steak properly, because it's more dense closer in and it's softer farther out, and when you're trying to cook a steak without cutting it open to see what it looks like, it gets more dense the more well done it is. So it's rare out here and it's well done back here. Yeah, if you're ever cooking a filet mignon, you don't want to cut it open and have everyone see you messed up. Squeeze your thumb and index finger area and say, okay, that's medium, that's medium. You'll see pinching done sometimes between two fingers as well. So the index and middle finger are another common one. That doesn't work as well here on the web. It works better if you're trying to stimulate points on the sides of like knuckles or fingers. But, you know, it is a traditional pinching technique.